The dream will take you very far, yeah. But when you wish upon a dream, life ain't no way for this single, yeah.
Thank you so much, everyone, for staying on. My name is Madison Wiziger, and I'm the California event producer with the Bisnow team. Quickly, I want to remind everyone when they get the chance to get some speed networking in and check out the expo pages in the lobby. Before we get started, I'd like to say a huge thank you to our sponsors for this session, Alan Matkins and Skanska. And without further ado, I'd like to introduce a great panel to get us started with this portion of the event. Shane Seitz, Senior Investment Officer from Ventas, Jake Rowe, Partner from Pacific Medical Buildings, Mike Kahn, EVP from Meridian, Mike Nelson, Pre-Construction Director from Skanska, and our moderator, Fernando Villa, Partner from Alan Matkins. Fernando, I'll pass it over to you to get started with introductions.
Thank you very much, Madison. Welcome, everybody. Thank you for joining our panel session today. We're very excited to present the topic. It's all about design, development, and construction of the healthcare industry and what, if any, impacts COVID has had on that industry and where do we see ourselves going from there. And as we've all experienced in this COVID era, this pandemic has shook our industry in ways never really fully anticipated by anyone, of course. And then pops the real question that seems to be permeating all of our lives in healthcare. What, if any, long-lasting effects will COVID have on this industry, our investment and development decisions? And what do we see on the horizon here? Obviously, COVID and its quarantine has wreaked havoc on the infrastructure of our healthcare, has led to lots of tragedy, many, many people falling ill. The healthcare system throughout our nation pulled and pushed to its utter capacity. And so where do we find ourselves now? We've had before the COVID era began, a huge and ever-increasing demand for high-quality, low-cost healthcare with accompanying inpatient expansion of hospital campuses, of a dramatic shift towards outpatient care. And that, in turn, drew investors and lenders alike into this industry, many of whom were very unfamiliar with healthcare assets, but which has spawned a tremendous diversity and range of development opportunity. Our panelists today will share their views on the healthcare real estate investment design and development and how that era, how our industry will emerge from this unforeseen debacle and what challenges and opportunities lie ahead for future growth. So with that, I'll start with the panel to ask them, each of the panelists, to provide a very brief introduction of themselves and their role in healthcare. Let's start with you, Shane.
Sure. Thanks for having me. I'm Shane Seitz with Ventas Healthcare REIT. We're a publicly traded healthcare REIT traded on the New York Stock Exchange. Our focus is healthcare real estate assets. We own assets from seniors housing to medical office to life science to hospitals. We're based in Chicago. I'm actually based in Denver. And my job is to actually head the MOB and hospital acquisition side of our business. And then also working on the structuring of joint ventures. So I'm excited to be here with Jake Rowe, who we've done a few projects with in the past, and I'd like to do some more projects with. So I'm buttering up to him right now as we start this project, or as I should be. And Mike Kahn, I'd like to do some work with you too, if you'll let me, but you never let me. So, and Mike Nelson, he's too good for a guy like me. So who's up next?
This is how you shame people into doing deals. I love it, Shane. I'll have to try that strategy myself. Let's turn our attention to Mike Nelson, the builder of all these amazing facilities that we all want to invest in. Mike, tell us a little bit what you do in your role.
Sure. Hello, everyone. Mike Nelson with Skanska. And Skanska is a global construction and development company with 28 offices across the United States. And on the West Coast, we have offices in Seattle, Portland, San Francisco, and in Los Angeles. And my role with Skanska is pre-construction director. So I spend a lot of my time working on cost estimates and bidding with the subcontracting community and trying to figure out what all these amazing projects cost. So some of our work in the healthcare realm, and healthcare is one of our largest markets at Skanska. In the Southern California region, we are working at the Hollywood Presbyterian campus, City of Hope, and Antelope Valley, among others. So really glad to be here and look forward to learning from the rest of the panelists.
Terrific, Mike. Well, we're glad you're here as well. We definitely need the construction perspective on this panel. Jake Rohe, let's talk about you and what you do. Tell us what kinds of deals you'd like to do, with hopefully with Shane, but even without. Oh, you're on mute there, Jake. Sorry about that.
I sure was. Thanks, Fernando. I appreciate it. My name is Jake Rohe. I'm a partner at PNB. We are a privately held healthcare development, investment, and property management company, focusing mostly in the Western United States. My role at the company is I'm involved pretty heavily in our strategies across the continuum of care, and then also looking at new partnerships across the delivery network, as well as leading individual development. So. I'm happy to be here with this panel. But for Shane, it's a really qualified group, and excited for the discussion.
Very good. And speaking of qualified panelists, including Shane, I'll add, Mike Kahn, tell us about you and what you do for Meridian.
Yeah, thanks, Fernando. Good afternoon. My name is Mike Kahn. I am Chief Development Officer at Meridian. Meridian's a West-based owner, developer, and operator of healthcare real estate in the Western U.S. We have 6 offices, SoCal, NorCal, Seattle, Phoenix, Utah, and Dallas-Fort Worth area. Meridian participates in build-to-suit projects for key clients. We do value-add, core plus opportunistic deals, and adaptive reuse of really good real estate. I personally have the privilege to be involved in all aspects of the business, ranging from client development retention to site building acquisitions, capital procurement, except with Shane, of course, and then entitlements, design, and love to do a deal with you.
Very good.
But really, our company mission is basically in our communities to provide greater access to care at a more affordable cost. So thanks very much for having me. Looking forward to the panel.
That's great, Mike. Just a real quick observation. I think you might be a little far from your speaker. We got most of what you said. You faded in and out a couple of times. So we want to capture every single word you have to share with us today. So let's start, as it would seem appropriate, with the big picture. Where are we today? How has COVID affected the timing, the design, and the development and investment in hospital expansions and outpatient care? First, I suppose we should start by asking, have deals or projects halted, or are deals and projects proceeding? And let's start with the deal guys, the tip of the spear, so to speak. Jake, let's start with you. What are you seeing out there, and how did COVID impact your decisions in the industry in terms of development decisions, financing, seeking capital, and where are we today?
Yeah, thanks, Fernando. So I think, generally speaking, I would say that COVID, paused or slowed down the industry for a period of time, a relatively quick period of time. We had one project that was canceled due to COVID, but it was largely kind of a primary care focused initiative in the Los Angeles market. So that provider was reevaluating their primary care access strategy as it related to telehealth and everything else that had picked up, very well for them and very successfully. So that one, unfortunately, we were bummed about that, but it made complete sense from a business perspective for the provider. And on the flip side of that, we had one that up in Vancouver, Washington, that landed in our lap. The construction lender fell out during COVID, and we were able to be responsive and flexible in structuring a deal there. So, all in all, for us, it's been we feel really fortunate to be in this industry. It's proven it's my second major economic event that I've been through in my career, and it's proven resilient again, our space. So we're excited about that. And I think recently, over the past 3 to 6 months, the sector has picked back up from our perspective, and things are on the move again. So hopefully, we're on the back half of this COVID thing. Vaccine distribution is obviously going well. Numbers are getting better, and it looks like confidence is picking up. So we're excited about that, and excited to be in a great industry.
That's all great to hear, Jake, especially as we see vaccinations rising and the light at the end of this COVID tunnel. That's terrific. Mike Kahn, I don't know in all the years I've known you, for you ever to be without some amazing pipeline of deals going on. How, if at all, did COVID affect that pipeline, and where are you today?
Yeah, I kind of agree with everything Jake said. We saw a general slowdown in April, May of 20. Everyone paused at the beginning of COVID. We had a couple jobs stop in the field until we could make the case that healthcare was essential to the various, counties and county health departments. A deal or two restructured midstream, so we really had to be flexible to the healthcare providers. We're looking for that long-term relationship, so we wanted to be that partner that could say, "Hey, we're gonna change gears on this project for you. We're not going to charge you rent. We're going to let you restructure the deal for something that works for you. So I think that they really appreciated that. But after that slow pause, we haven't had much issue. Seems like confidence is picking up. Everyone's adjusted to the new normal, just undertaking common sense safety precautions and evaluating their portfolios and what they want to do. I'd say the capital markets were kind of frozen at the onset of the pandemic, but they're thawing out now. There's tons of money out there for the right deals. Well-located credit tenants. Frankly, just anything with the word medical in it, and there's money out there. Some are more risky, speculative plays, but every deal has its challenge. You just got to match the right deal with the right money.
Well, speaking of frozen and thawing capital markets, Shane, how have equity and debt markets reacted to all this? Where are you today? Where were you back in April, May, when supposedly we had somewhat of a freezing of the capital markets, and especially on the financing side?
Yeah, no, Mike nailed it on the head. I mean, you want money, there's money to be had. It's no problem getting money today. I think there's so much new capital that's come into this space. There was already a ton of capital coming in because of the healthcare space prior to COVID, but it really accelerated coming out of this. If you think about the fact that, retail was already having some challenges, retail basically shut down. That's a very hard business to be in these days. So if you're a retail investor, you're looking where you can put those dollars to work and have a risk-adjusted return, and compare that to office as well. It's downtown office buildings. There's a lot of central office markets that are struggling to retain tenancy, to attract new tenancy. That's going to be a little bit of a slow market. So it's easy for that capital to transition into the healthcare space and understand it somewhat. It's been around long enough. It's been proven that it's a viable long-term investment. When it started, though, we definitely saw a pullback. Everybody still has 2008 in their memory. Jake mentioned living through that. I lived through that myself. During that period, it was more difficult to get capital to open up. I think the government did a great job with stimulus and really opened that up and really got the debt markets moving a lot faster than they did in 08. CMBS markets came back when we first hit the pandemic. The CMBS markets, nobody knew when they were going to come back. They came back fairly quickly. A lot of the public companies grabbed their capital. We were one of those groups that pulled down our line of credit. When the capital runs out and you can't pull your line of credit, there's no money to be had. So we took that precautionary move, and we're happy we did. We didn't need it, thankfully, but it really did stop. And when you look back to 2008, some of the lending opportunities for not-for-profit health systems that existed in 2008 don't exist today anymore because of the way that market impacted the ability to raise capital and put it out. So we thankfully didn't have a lot of that through this one, which is great. And as Mike said, everybody's open for business and everybody wants to get money into medical office, and life science is probably the other really hot one these days.
Excellent. That's great to hear, Shane. Very, very good to hear. And it's nice to see that we're not replicating what we did in the Great Recession debacle. So let's talk, Mike Nelson, about the construction industry perspective. What happened? It seemed as though when COVID first hit, we still saw construction activity occur in a generic sense. But how about healthcare? How was construction impacted when COVID hit us last spring?
Yeah, so the way it looked from the construction side is there was that brief pause that each of the other panelists had mentioned. And so during that period of time, there was increased competition at the subcontract and general contracting level for some opportunities. But it was really a small period of time when that occurred. And it's really come back quickly. So, whether the recovery will be more of like a U-shaped or a V kind of remains to be seen. But on the construction side, it was very busy before COVID, especially for healthcare and the skilled general contractors and subcontractors that build that kind of work. And then it came back very quickly, and the prices are escalating accordingly. So, to spend a minute talking about some of the different components there of the cost, on the labor side, we are seeing the escalations at the craft level that have been agreed to over the past several years. So they don't really have as much flexibility to go down when there is a downtrend in the market. And then also the inefficiencies to actually build during COVID. Early on, when the protocols were new, there was actually a sizable percentage of additional labor that was required to accomplish the same work. So, with the just the one-way traffic through your job sites, extra cleaning provisions, things like that, they all did increase the cost for labor. And in some cases, we'd see studies that said 6-8% of labor premium. Thankfully, the industry has improved on that over the months that we've had the COVID restrictions in place, and those are starting to become less and less. And of course, we all look forward to the period of time when they go away once the vaccinations and everything are in place. But that's one of the main drivers is the labor side. Labor has continued to increase in cost. We're also seeing escalation on the material side. So on the material front, we had a quick slowdown, and all of the commodities that serve the construction market, they slowed down as well. And maybe they didn't forecast how quickly things would come back. And so now we have this kind of temporary imbalance where there's not as much material available to purchase as the construction market wants. And so we're seeing large escalations, 10% month over month for some materials like metal studs. And we think that'll sort itself out as well in the months ahead as the suppliers see that the new progress and the projects going forward. But in the short term, it does lead to some risk and some uncertainty on the material purchase.
Well, Mike, I'm going to throw you a curveball because I like to do that from time to time to make sure that everyone's awake and paying attention. And that is, you've seen the new administration's focus on passing legislation or taking executive order steps to make sure that supplies of commodities of an essential nature, right? Whether it's needed for computer chips, whether it's titanium, whether other core materials that we need for construction. How, if at all, do you see the administration's focus on ensuring the supply chain remains intact, that there's certain critical materials for construction and design for technology are available on a time as needed basis? What's your views on that?
Yeah, so my views are that there's still the materials are available. It's just the pricing is very fluid at this point. And so that can cause problems and pressures on project teams to know when to purchase that particular material in order to get the best deal for their particular client. So I don't see there being any kind of long-term shortage or anything that would need that extra boost from the government, so much as in the short term, the prices are going to be variable, and the project teams would want to work together to understand how to best mitigate that risk.
Very good, Mike. And we will later on return to the issue of price and cost control. But right now, I really want to shift our focus to some other large picture perspective. And that is, before COVID, we saw an enormous shift from inpatient to outpatient care. And that was seemingly unstoppable before COVID. How, if at all, has that shift changed? And I'm going to combine that question with another very much related question. Where do new investment and development opportunities lie? Is it MOBs? Is it repositioning some of those empty offices of which you spoke a short while ago, Shane?
Well, it looks like Fernando locked up there. Well, I'll jump in, and Mike Kahn. Actually, I'll make Mike Kahn talk first, because Mike, you're doing a lot of the value, or I should say, not value add, but really repositioning. That's a couple of the projects I know you guys have going. Maybe you can tell us about a couple of those projects. That makes sense.
Happy to. I hope you guys can hear me.
Yep, you're good.
Yep. MOBs repositioning, that's a big opportunity for us in our business model. I'll give an example of a project we're working right now in Irvine, since this is the SoCal Healthcare Conference. We recently took down 110,000 foot general office building, all cash, in the middle of COVID, with the plan to vacate all the tenants and convert to full medical office. Great location, less than 2% vacancy in the medical office market. To do this, we're building a 325 stall parking structure to up the parking to about 5.5 per thousand. Just broke ground on that, and that will support future medical. So we're going to prep the building to support OSHPD 3, surgery center, imaging, and medical office on the upper floor. So this is a great example of a highly speculative play. It's on the far end of the risk spectrum, but the opportunity was there in an incredibly dense urban infill market where sometimes repurposing an asset is really the only play to fill a need in the community. So it's often a faster speed to market as well.
Are you doing that deal, Mike? Are you doing that deal with a health system or with kind of a tenant in hand to kind of get that kicked off, or is it pure spec? Like you've got nobody lined up and you just saw, hey, look, great market that needs healthcare, and we'll find a tenant that will come to this market and capture this demographic, or what was kind of the genesis for that deal?
Yeah, well, at the time we took it down, it was purely speculative. We did not have that anchor tenant in tow, so that was very high on the risk spectrum. But with big risk comes big reward, and the return should reflect that.
Great. Well, good for you. That's awesome. Jake, what are you guys doing? I know you guys have been looking at some behavioral health. It seems like that seems to be popping up and kind of percolating, has been percolating for the last couple of years. What are you seeing in that side of in that side of the sector, or that new opportunity space?
Yeah, no problem. Shane, that was an amazing just transition from panelist to moderator. That was magical.
Look, we talked about this. This is the thing that nobody realized. Yeah. We talked about this very thing before we even got on this. So I was prepared.
You are one talented dude. So I'll answer the question, Fernando. You're coming back in, but we're still kind of on that previous question you hit on. So, I think Fernando's question was, where's the opportunity out there? We haven't seen any notable shift in the inpatient to outpatient pressure or momentum. I mean, it's only strengthened, I would say. We have seen, some we're in the inpatient rehab business on the post-acute side, and then we're pursuing three separate behavioral health opportunities as we speak, both inpatient and quasi outpatient as well. So, I think that when you look at where healthcare policy is taking healthcare delivery, it's really, especially in California, really towards a managed care construct. So, it's not just about inpatient. It's not just about outpatient. It's not just about home health. It's really about the full continuum. I think that the payers are pushing the providers to participate along the continuum. And with that, I think will come opportunities. Historically, the post-acute, the behavioral, for the most part, we're all provider-led developments, but I think that's shifting a bit as capital is, still constrained and managed care continues to proliferate in certain progressive markets.
And I think some of the projects you're looking at too, Jake, which has not historically been the case with behavioral health, is really being driven by the healthcare system and kind of coming together and recognizing there's a need. And I think, the Affordable Care Act, now that we have a Democratic president, Democratic control, that's probably good for a couple of years here, where we don't have to worry about a repeal of the ACA, which has been beneficial for the behavioral health. And clearly we continue to have behavioral health issues here in this country through substance abuse and other things. But, is that what you're seeing? More and more systems that are coming together to try to deliver that need for the behavioral health? Yeah.
I think there's a project up in the Tacoma, Washington market. There was a joint venture on the behavioral side between a couple of existing, competitive providers up there. There's a really, really cool one in Orange County. Speaking of Southern California, it's called Be Well Orange County, and that's a consortium of providers. That Hoag's involved, Kaiser's involved, Providence is involved, Memorial Care's involved, the County of Orange. And the largest Medi-Cal payer in Orange County is also. And these are, partners that are, financial partners in this deal. So it's really, really cool to see the industry not just, shun that piece of the business anymore. And on the flip side, not just, kind of wait till that patient population shows up in the emergency department, which is not where you want, you want that patient population. So movements being made. I think, before COVID, it was really, it felt like it was really, really ramping up and getting a lot of the needed attention it deserved. Everything got, put on the back burner for COVID, and, now we're in vaccine distribution mode, but it seems to be coming back a little bit too. So we're seeing a consortium of providers coming together to address, behavioral health populations at more regional levels and more regional scales. We're also seeing, single providers coming into a market to address it on their own. So we're seeing both, Shane.
Yeah, and I one of the other things that I found that's fascinating is more and more health systems are starting to talk about the homelessness and how that's impacting their balance sheets and how that impacts, the charitable care that they provide. Here in Denver, we've got our community hospital, our community health system, Denver Health, is actually building, partnering on a multifamily development. So they're going to take the top few floors and kind of move some of those homeless patients out of inpatient long-term care that's taking up beds that probably don't need to be there, but they can't be discharged anywhere else. I was with the CFO of Providence St. Joe's pre-COVID, and they were talking about how the amount of money that they spend on charitable care, they could fund a house for every, or a place to live for every homeless person in the city of Seattle. And so I think the more and more that we talk to hospitals and health systems, they're trying to recognize that component and figure out how to kind of, help that issue, which will ultimately help their bottom line. Hey, Mike Nelson, question for you. This isn't something that was on our list, but maybe you can talk about as I bring up the housing side of it. Are you seeing construction costs rising because there's just so much demand, or is it a lack of product? Do we have a backflow, I guess we're waiting on product or lumber to show up because it hasn't been milled from the forest, or what's kind of causing the big jumps in the pricing here these days?
Yeah, so it's an interesting question, especially on the lumber side of things. So we don't do a lot of residential work at Skanska, but we are working on a mental health facility up in the Bay Area that is a wood frame structure. So I have been keeping a close eye on that area of the market. And what I've found is the prices have been going up extremely fast in that corner of the market as well. And one of the main driving factors on that is the residential market was extremely busy, driven by a lot of people over the past year have been kind of refocusing at their own houses. So this is, wanting to expand your own home, maybe wanting to do, your home improvement activity. Those kind of things actually did drive some of the market pressure on wood. So, it kind of, all those trips to Home Depot do make a dent in the market in that regard, and do have follow-on impacts into the larger commercial construction environment as well.
So what I just heard is everyone needs to stop going to Home Depot. So everybody that has a honey-do list, you're allowed to not do anything on the honey-do list. Fernando, let me go ahead and kick it back over to you.
No, it's all for the common good to provide healthcare, right? And by the way, I apologize to everybody. I'm actually switched over to my iPad. I don't know what happened. I just got cut off, so my apologies. Couldn't get back on. So yeah, no, let's continue on this topic just a tad bit. And I don't know, Mike Hahn, if you've had a chance yet to address this topic, but it's interesting you raised this idea of mixed-use healthcare and affordable housing, because we're starting to see that phenomenon occurring. Kaiser Foundation Hospitals has a fund, for example, exclusively devoted to affordable housing development on or near its campuses. So it's an amazing development. And behavioral services, Jakey, is exactly something that's been in huge demand in California, for example, and other states where the governors have stated emergency need because inventory is so small. It's great to see investors and developers investing in the space. Very quickly for you, Mike Hahn, tell us about what you're seeing. I mean, Shane talked a bit about some of these empty offices downtown and MOB repositioning. It seems to me there's a lot of underutilized space in this COVID era. What, if any, opportunities are you seeing for repositioning, MOBs or otherwise, Mike Hahn?
Yeah, thanks, Fernando. I touched on one project while you were offline, but I'll give an example of another one in Southern California. About a year ago, we took down about a 56,000 foot culinary kitchen building, and we had the idea to convert it to Oshpod 3 and handle medical. It was parked for it. We could get the zoning for it. So we had it half pre-leased to an FQHC, a PACE clinic user. And the cash flow from that lease carried the asset until we get it stabilized and leased up. So, if you have good real estate, some fancy entitlements, a little bit of pre-leasing where you can get some debt on it, you can generate most of your profit for the deal in the lease up. That's really the play. And I think there's a lot of buildings like that, retail boxes or general office conversions. As Jake said, we're seeing a lot of opportunity in the behavioral sector. We're pitching a number of deals. We just bought a big hospital building out in Tucson with a behavioral component. So it's not our first behavioral deal. But we are learning every time we do a deal, and we'd like to do more of it. It's a good space and it's needed.
Fantastic. Well, Shane, you've been moderating in my set. Let's talk about you, what your investment opportunities are in this emerging space and outpatient or otherwise. What are you seeing as good investment deals? And actually, I also wanted to focus on some of your challenges, like providers' liquidity, for example, or their asset portfolio, or reimbursement rates and other considerations. What are you seeing out there, and what do you see as challenges to overcome?
Yeah, the challenge is finding product. The challenge is there's too much money and not enough product. There's plenty of good things to buy, but everybody's trying to buy them. So I mean, we'd love to buy some more medical office building, add those to our portfolio. We've actually been really focused on the life science side of the business. We did $1 billion transaction last year in South San Francisco, which was a really great project. We just got largest deal in California, or second largest deal in California, or something like that. I just saw come through on my email. So it was a really exciting project. And we actually kicked off a fund last year, right around this time prior to COVID hitting. We did that in our fund. So we've created a core fund vehicle that we have institutional capital investing alongside us and international capital. And then we also created a joint venture with GIC where we are co-developing academic life science medical center opportunities with them, which is pretty exciting, which we haven't done in the past. So we've got several $1 billion under assets under management now, which was all done during COVID era. Opportunity-wise, we continue to see life science. We continue to see strong demand for those buildings, strong interest from capital. I think seniors housing is interesting. There is going to be demand for that. Our belief is that it's a safe place for mom and dad to be. Everybody's been vaccinated. It's great to see the CDC come out and say that if you've been vaccinated, you can hang out with others that have already been vaccinated. So that means that most of our communities with our moms and dads or grandparents in those facilities can now go back to their regular way of life, going to have dinner together, having those group activities, getting that social interaction. They don't need to be at home and be afraid of, the kids coming home from school and potentially bringing COVID home. So seniors housing, assisted living, memory care, those facilities are great for mom and dad or grandma and grandpa to still go to. We're excited about that. We think they're the right place for people to go long term. I selfishly can't wait to go to one. I've been to a lot of really cool facilities. I know Jake and PMB just built a really great facility in Washington. I have not been able to tour that one, but there's some great facilities out there. So yeah, we're excited about the market. We think it's a great time to be a buyer. We think it's a great time to be an owner long term. I think the challenge that we face is I think health systems also are well capitalized, well liquidated at this point, have free capital or free access to capital. And we're seeing some health systems, depending on where they are in the country, want to own their real estate assets, which gets a little challenging for us because we want to own their real estate too, which causes more pressure on buying things. But there's a whole theory I could go into about that as to, if you're in the hospital business, you're really in the hospital delivery of healthcare business and not in the real estate business. But who am I to tell a health system what to do? I've tried that many years over the last 20 years and it never works. So I'll just wait for them to tell me what they want to do. Jake's smiling because he's been there. Mike's smiling because he's been there too. We've all had that conversation where we try to ask what the cost of capital is, and they all say it's the cost of their debt. But that's not how the weighted average cost of capital equation works. So,
very good. Well, it's interesting. Senior assisted living. I've heard both sides of that investment opportunity. Shane, on the one hand, people are saying, well, we're all anticipating baby boomers to age enough so that senior assisted living really takes off. It's taken off already, I suppose. But others are saying, well, wait a minute, baby boomers are not quite there yet, right? We still have another 8 to 10 years to go before that really takes off. Mike or Jake, what do you? Jake, I know it sounds like you're already going into that space, but Mike or Jake, what are your views about developing senior assisted facilities? What are the opportunities and what are the financing prospects for that? Mike Kahn?
Mike, you want? Okay, go ahead, Mike.
Yeah, I was going to defer to Jake. We're not really active in that space. It's a space I'm interested in, but we don't have a lot of experience in it. So I'll defer to Jake or Shane.
Okay.
Yes. So I think generally speaking, I agree with Shane wholeheartedly. I mean, we're in the business and we're looking to get deeper into the business. That being said, we're being extremely picky. We just went through our statistics for 2020. I think we looked at 59 different projects and we pursued 5 of them. That is an operating business. It is not real estate. It is an operating business. You can have the best location, best asset, most beautiful everything. And if you have a poor operator, you will fail. So we're very, very hyper focused on our operating partner. And have partnered with some good ones and are evaluating some new opportunities. So, long term, it's a healthcare delivery model. I mean, it's not an amenity business. It's not apartment buildings. So we are very vested in really high quality operators who understand the nexus to healthcare. And then we're trying to bring our provider relationships even closer, kind of back to that managed care construct to tie the senior housing space closer and, more integrated into the overall healthcare delivery platform.
Well, that's great. And integration is actually one of the, I think, goals that we see a lot of healthcare providers trying to build with senior assisted living facilities. It's funny, my parents are now in one of those facilities, and they have an amazing set of relationships with providers all around the community. And instantly, anytime any of their residents have any health issues, they're immediately taken care of, either on site or at the campuses. Mike Nelson, I want to shift our topic for just a bit. We talked about opportunities, but I also want to focus on the challenges. I mean, we can't be completely Pollyanna-ish about this. There are some risks out there. One of the things that I think we've touched upon a little bit, and I want to get back to, and that is in the construction realm. I mean, obviously, providers, builders, investors, they all want some kind of cost efficiencies baked in, with costs rising as they are, value engineering, cost controls. Everyone's watching the bottom line. Shane wants to make sure he gets his return on investment. But how do you achieve cost control or value engineering in an era of rising price construction increases in your industry? Tell us, Mike, what you're doing.
Yeah, so one of the keys that we recommend is early involvement with the client and the design team and the builder. So what this can help with is establishing that budget with that team of experts. And then you're able to manage as the design moves forward, the client's able to make design decisions and trade-offs according to their value management analysis. So, when the costs are rising, it's a challenging environment for all the team members. But that kind of collaborative approach can help make sure that the initial budget is the budget that you deliver the building at the end of the day. And I think that cost certainty, especially in a market like this one, is extremely important. So, yeah, our guidance is absolutely early involvement by the costing and design experts along with the client to make sure that we are all on the same page from the beginning and deliver that in the final product.
Well, it's a great advice, and it's a nice way to plan and hopefully avoid some of these cost surprises that typically, or often I should say, affect projects. I want to shift gears a little bit to the developer side of things, Mike and Jake. Many of the opportunities that I know you two and others are seeing lie in urban markets, right, where the barriers to entry are high, land is scarce, so much as Shane was talking earlier about just finding deals, available land, and land values. Residual land values still remain very high in spite of COVID's supposed impact on pricing. Tell us, Mike Kahn, what are you doing to deal with those barriers to entry? Are you still finding opportunities, dealing with cities on entitlements, finding deals, and how are you being creative to get over those barriers?
Yeah, if we're talking about California, it's really nothing new for Meridian. We've been cutting our teeth on these type of deals for years in high barrier entry markets. California is a very mature, healthy real estate market. Land is scarce. You got to get really good at land assemblages, fancy entitlements. You might hire somebody like Fernando to help you get through CEQA and land use, and maybe he knows how to navigate a city. You got to get real creative with your deal structures. Get enough time from your sellers to put a deal together, or ground lessers. And you got to create projects out of nothing sometimes. There are not many 2 to 3 acre sites of land left on the corner of Main and Main that are zoned for an MOB. I mean, there just aren't in California. So creativity, trying to find those pockets and those catchment areas where those providers want to be and try to put a project together by partnering with them.
Very good. Jake, how about you? It would seem in these times especially that cities want to see healthcare providers come in, want to see MOBs and other services to help alleviate the health-related concerns of their own constituents. What are you seeing, Jake?
Yeah, I mean, on the land side, I have nothing brilliant to add in addition to what Mike said. I totally agree with Mike. The cities, you would think that healthcare would be something that every city would want at some level, even the cities that have a tremendous supply of healthcare. It's not always the case. So we're taking a bit, the last couple or few years, we've taken a bit of a different approach. Traditionally, we kind of understand the underlying zoning or specific plan, and we'd look at the pre-app and do the checklist and kind of go through the process. Whereas now we're trying to get ahead of ahead of the curve a bit more and we're trying to meet with the cities in advance with the higher levels of the city and really communicate the need and back that need, with data for what we're trying to accomplish, and really enlist them to help us in the process and be our, advocate and partner here at somewhat level versus just a municipality that's processing, another project. So hopefully, COVID and events like COVID will hopefully open the minds of these municipalities to look at healthcare more as a social infrastructure versus, another building type. So I hopefully what all of us here are focused in becomes something that's desired by cities and wanted. And in certain markets it is, and in certain markets they make it, as tough as anything else. So we're excited about the future and truly believe it's, part of the social infrastructure of this country, and we'll stay committed to it.
Hey, Fernando.
Yes,
we're getting down to 5 minutes, and we've got a couple questions in our chat room, so maybe we want to take a look at those.
I was going to ask you all, because we do have the questions in the chat room. There's still a couple other things I want to raise, but let's go ahead and start taking some of those questions. It seems that would be a good place to start. So, Mike Nelson, this one might be for you. It's one of the questions that came from Eleni Christensen. She says that lumber is leveling off. That steel seems to be the new hurdle and the long lead item. Scrap metals being shipped overseas and manufacturing delays are causing a rise in prices. Can you want to address the issue of steel and perhaps other commodities that you're finding problematic in terms of pricing or availability?
Boy, I'm glad I'm not Mike Nelson and have to come up with an answer for that one. Good question.
I'll give that. So a quick note on the wood. One of the things that we are seeing is, not only wood being more expensive, but also the builder's risk insurance coverage for building a wood structure. So that is something that the folks on this call would want to be mindful of as they're working on a wood project and maybe doing the cost benefit of different types of structures. As far as the steel, yes, we are seeing the steel rates go up quickly, and it is tied to scrap being available. And so that's impacting not only structural steel, but things like reinforcing steel as well. Where the market's going to go in the future, only time will tell, but it looks like we're hoping that it will stabilize in the months ahead. As far as other material commodities, it's, metal studs is another one that's very active right now. So another one to keep an eye on as you're working through your construction costs.
That's great, Mike. Madison, I don't know, with the 2 minutes left, if I have time for another question from another member of the public, you can tell me no if that's the case, but it's an interesting question. I'm not sure if our panelists have the answer. Do I have time?
Yeah, this could be the last question.
This will be the last question. This came from Rita Reyes Acosta. She's asking if any of you use service planning areas to address the sparse healthcare services in low-income areas with high morbidity, or work closely with public health centers to bridge the gap in specialty services. Anybody want to take that on our panel? Shane,
I'm not qualified to answer a question like that. That seems like a smart person should answer that question. Truthfully, it's a great question. It's a very good question. I think that's probably something that all of us, the four of us panelists, probably don't get involved in quite as much as others would. That's more of a planning question. That's more of a healthcare delivery question. Really, we're all focused on the construction, ownership, and development of facilities. And we understand just enough about healthcare delivery, but we actually don't provide the healthcare delivery. So it's a great question, Rita. And thank you for asking it, but I just don't think that I'll give you a great answer. You probably have a better answer, Rita, that you could share with us if you were on this call right now.
Well, I'll hit a little bit on that one for you. So, service planning areas, not exactly sure how you're defining that, but I assume it's like a market area. From our perspective, we're going to where healthcare needs to be, and sometimes that's at Van Ness and Geary in downtown San Francisco, and sometimes that's in El Centro, California, in the Imperial Valley. We did an FQHC out in El Centro. I know Mike's done quite a few FQHCs. So when you start to look at markets, El Centro, California is never going to pop off the map as a market that a lot of the capital providers will want to be in. It's not a core market. It's not a major market. But healthcare there is just as important as needed as downtown San Francisco. So, we're looking at markets in and of themselves and figuring out what needs to be there and partnering with the appropriate providers for that patient population.
Very good. I suppose we should probably stop there, right, Madison? I want to be right on time, and it's 1:45. I hope you're proud of me.
Yes, thank you so much, Fernando. And thank you so much to all of our speakers. To our attendees, stay right here on the main stage for our next panel, Medical Office Building Design Considerations and Retrofitting Existing Facilities to Accommodate for Pandemic Needs. To join, stay right here in the main stage and select join on the next section. Thank you so much.